Hi, everyone. Welcome while you're joining. My name is Rachel Lieberman. I'm the director here at the Celiac Disease Center. We are so happy everyone has joined us for our Dinner with the Doctor series. This is part two of the neurological effects of celiac disease. And I just want to, I know Lindsay may have sent out communication already, but we will resend the video of our part one if you were not able to join and watch that the first time. This is going to be a really robust Q&A. We had so many questions that we did not get to at the last of our programs in the fall. And so we're really excited to address a lot of those questions tonight. And I am so thrilled to have with us tonight, Dr. Douglas Nordley, who is the Chief of Pediatric Neurology here at Comer Children's, as well as a professor of neuroscience, a professor at the Neuroscience Institute. Again, part of our part one series, we also had Dr. Joseph Fink, who is a professor of adult psychiatry and associate professor of the Neuroscience Institute, and Dr. Farida Mahmood, who is with us. She is an adult neuropsychology extern. She is with us at the University of Chicago, and we are so thrilled to have her back, as well as Dr. Ritu Verma, who is our Chief of Pediatric Gastroenterology here at Comer Children's, as well as our medical director at the Celiac Center. She is running a little behind, but we are going to get started. I'm going to turn it over to my colleague, Lindsay Yakel, who will start us off with our Q&A. And I just want everyone to know, housekeeping, this is being recorded in case for some reason it's a hectic night and you can't stay throughout the whole thing or want to refer back. Please know we will send out this recording after. So, Lindsay, I hope I covered it all.
I think so. I do want to mention Dr. Fink was not able to join us this evening. He is ill. But the things that Dr. Fink was going to talk about, Farida will be covering after the Q&A. He had some specific things that he wanted to go over that I think you'll all find really useful. So anyhow, we will get to some of his topics specifically in a little bit. So yes, I'm going to start out with asking some questions that were posed for our first part of this event. And because we didn't get to all of those questions that people gave us, we decided that night that we would do a follow-up. And so here we are. This is our follow-up, part two. So I'm going to go ahead and get started. First question that was presented is, what are some of the long-lasting or permanent effects of brain fog? Farida, maybe you're able to answer that.
Sure, yeah. Thank you so much for having me again. I'm so honored to be here and speak with all of you. Dr. Norley, please feel free to add anything that you think I may have missed for that question. But essentially, when we think a lot about brain fog, sometimes we can think of it as more of like a state of kind of confusion, lack of clarity in the moment, very much like kind of mental slowing. And what we see is that in terms of the long or duration of effects, it's quite multifactorial. And what we mean by that is most of the research does indicate that kind of early diagnosis, that being age being a significantly protective factor, is a significant predictor of kind of like post or more so less long-term effects. Delayed diagnosis can often lead to more long-lasting effects of brain fog. In the presentation from the previous meeting, I kind of explained a little bit about the etiology behind that, but just to kind of give a quick overview, I guess. A big component that we see for patients who have ingested gluten, and this can be within 24 hours of ingestion, is sometimes we may notice some concentration difficulties, problems with inattention, some kind of like lapses in short-term memory, sometimes word finding difficulties, slight confusion as well. And the onset of these symptoms and how long they last for depends on the frequency of gluten exposure, the severity of mucosal injury. So when we think about people who've been ingesting gluten for a long time, the gut lining is kind of damaged over time as a result of chronic inflammation. So that's one of the other things that contributes to that brain fog. Level of exposure, as well as other factors that may be contributing. So if an individual had underlying kind of obstructive sleep apnea or hypertension or diabetes, other underlying vascular concerns that also contribute to that inflammatory process, this increases the likelihood of more long-lasting brain fog symptoms, again, because all of these have kind of an inflammatory etiology that kind of has the same mechanisms and pathways that contribute to brain fog.
Thank you. Thank you. That's great. Okay, so moving on, we had a lot of questions related to ADHD and the prevalence in patients with celiac disease. Is there a relationship? What is the overlap between them? Those kind of things all related to ADHD.
Yeah, thank you for that question. I think with ADHD, it's really interesting because I think ADHD symptoms in of itself have a lot of overlapping to symptomatology with other kind of, whether it's kind of psychological disorders or even other symptoms that we see in other neurological or GI conditions. When we think of ADHD, a lot of times we think of it as a neurodevelopmental disorder, right? Like it starts at a very young age. One of the diagnostic criteria is you have to be meeting certain types, number of symptoms before the age of 12. And so with ADHD, or with celiac, should I say, a lot of studies have shown that there is kind of a positive correlation between ADHD and celiac disease. But again, there are some mixed findings regarding the exact base rates of these two. And there are a lot of ADHD-like symptoms, or let me rephrase that, I guess, celiac disease can mimic a lot of ADHD-like symptoms. And again, this can be due to a lot of the inflammatory pathways that influence these specific symptom onset and trajectory. It can be as a result of how gluten exposure affects a lot of the neurotransmitters. So serotonin, dopamine, and GABA, these neurotransmitters are implicated also in ADHD. So the symptom overlap in terms of concentration difficulties, attention deficits, kind of mental slowing, problems with divided attention. We can see a lot of that overlap. Now, another important factor to consider here is if someone does have ADHD-like symptoms, first of all, we need to look at when these symptoms started. Were they since childhood or was it more recent? And so if an individual who is experiencing some of these symptoms starts to have to comply with a gluten-free diet, and these symptoms eventually resolve, then that is more so, again, an explanation better explained by celiac disease rather than ADHD per se. So kind of to summarize, we do see a lot of overlap between these. The base rates is not, in terms of the likelihood of comorbidity, is not very definitive, at least from my understanding of the literature. However, we do see a lot of symptomatic overlap. And so a big component here would be to look at the onset of these symptoms and see how your body is responding to a gluten-free diet and the improvement in symptoms as a result.
Very interesting. Thank you for that. Dr. Nordley, to what extent is undiagnosed celiac disease responsible for seizures in preteens? One of the questions that was submitted.
That's an excellent question. In general, the literature is suggesting that only about 5% of people with celiac disease have epilepsy. But it's a challenging thing to diagnose, and the neurologists have to be suspicious of the diagnosis in order to secure it. Epilepsy is quite common. 1 in 26 of us will develop epilepsy at some point in our lives. The Swedish have determined that the incidence of epilepsy is about 1.4 times higher in people who have celiac disease. So a bit higher than the general population, but there's a pretty high prevalence and incidence of epilepsy. So within that group, one has to be alert and suspicious of what are some of the cardinal features that might suggest celiac disease. And, and those are particularly a posterior or an occipital focus, particularly if there's white matter changes on the MRI, or of course, if there are calcifications. So I think there's an expanding awareness of this, but it's not ubiquitous. So I think it's a good thing for the community to bring to the attention of neurologists that, given particularly the genetic underpinnings, that this is a possibility in case that arises.
Excellent. Thank you for that.
And I'd just like to add there, I think that, from a GI standpoint, we do have these associations and not necessarily just seizures, but other neurological manifestations. But so important that, we have all the literature coming out and there's a lot of discussion about neurological manifestations, but it's so important to have the diagnosis of celiac disease made before just assuming that all of the neurological symptoms are related to celiac disease, and that diagnostics are so important, just like we heard, earlier with Dr. Nordley, in terms of not everyone who has a seizure has celiac disease. So I think it's important that we manage the seizures. We do see the neurologists, we do see the neuropsychologists, and then look out and see if there is celiac or not.
Yeah, I think that one of the challenges is that, when it's within the pediatric population, greater likelihood that there might be other intestinal manifestations, but in adults, that's not necessarily the case. So I think it is trickier in adult patients.
Thank you. So along these same
depend a little bit on
along these same lines,
and a schedule thing.
There's a question here that asks,
you can
does
talk a
celiac
little
disease
more
cause
about how
seizure-like
houses
activity?
work for juniors and seniors?
So
I mean,
not specifically
how houses
epilepsy,
work
but
for
can there be
juniors? I do.
seizure-like
It's just
activity
pretty
with celiac disease?
self-explanatory.
Okay, that if you're taking mostly APs, or you get divided that
And
way.
so
You're in a house.
if everyone could take themselves off or mute
Or
themselves.
advisors. Those
I
advisors are your advisors for junior and senior year. Probably, unless there's other circumstances. There we go.
sorry.
No, that's not a problem. In general, that's it. It's another challenging area for us. We didn't mention I'm an epileptologist, so my focus is epilepsy. So that, yes, that is certainly a possibility. So we can see epilepsy-like manifestations that are not truly epilepsy in people who are exposed to any one of a number of different stressors. And this is not rare. About 25% of the time, people who are referred to us for refractory epilepsy end up having seizures that are not due to epilepsy. So it's an important consideration regardless of the etiology. It's not always to just assume that the symptoms are related to epilepsy. They can be distinguished many times by a careful history, or sometimes seeing the events. Nowadays we say that everybody has half of an epilepsy monitoring unit in their pocket with a video, and capturing the video can be super instructive to the neurologist and epileptologist if that is a consideration.
Thank you. I appreciate that. And then one more question on the same line. We have a certain person who experienced 2 tonic-clonic seizures at the age of 30, which were diagnosed as epilepsy, and this person's been on medication since. Now, 35 years later, they were diagnosed as silent celiac. Could there be a connection between the two?
Yes, there could. And I'm glad to hear it. It sounds like I'm inferring from that individual has done well, and I'm really happy to hear that. One of the most important things in that circumstance, of course, is avoiding gluten. Um, the good thing is that oftentimes we can use the EEG, again, regardless of the cause, we can use the EEG to monitor and see what the likelihood of recurrence is. So, generally speaking, with generalized tonic-clonic seizures, you often have an EEG signature. And so going forward, we often will use serial EEGs to monitor, see how prevalent, how high is the risk of a recurrent seizure. Like, let's say if it has been affirmed that it was due to celiac and that person is on a strict diet, and you might think, is it time to consider, you know, discontinuing medications? You can talk with a neurologist, but the EEG can be extremely helpful in that circumstance.
Okay, Farida, here's one for you. What's the relationship between celiac disease and bipolar disorder? And also, Dr. Verma and Dr. Nordley, please chime in too.
Yeah, really good question. I think that when we think again about um, mood disorders, I think one way that we have to look at it is not just kind of the underlying etiology that's common between celiac and these mood disorders, but rather how lifestyle associated with celiac can be a significant exacerbating factor of a lot of these mood disorders. So, for example, when we think of celiac and a lot of the food restrictions that we may have to deal with, a lot of times that can in of itself be a trigger for more like anxiety around food, especially in social gatherings, more limitations of what I can eat, what I cannot, like more like hyperfixation on that too. So I think there's an environmental component that we have to always keep in mind, but at least from a kind of biological standpoint, there's a lot of literature that looked at the relationship between major depression and anxiety, more so than bipolar, but there's definitely a lot of symptoms that individuals with celiac, there may be a little bit of overlap. I will say a lot in terms of, again, the mental slowing, the kind of fatigue, maybe even at some point, a loss of appetite. And a lot of one of the kind of most leading theories behind that is there's the kind of precursor called tryptophan, which is something that it's a precursor for the neurotransmitter serotonin. And this neurotransmitter is significantly implicated in a lot of the mood disorders that we see. And the synthesis of this particular precursor happens in our gut. Actually, 90% of it happens in our gut. And so when there is a lot of chronic inflammation and disruption of kind of what we call gut dysbiosis, so kind of dysfunction of gut microbiota specifically, we may see a lot of decreased serotonin synthesis, and which again may also affect a lot of these mood symptoms. Another component, another leading theory relation to bipolar and major depression is inflammatory theory. So we know that there's a lot of correlational studies that have looked at how bipolar disorder was associated with high levels of inflammatory biomarkers, very much similar to what we see in celiac as well. And if we think about celiac in of itself, it's an autoimmune condition, right? So with an immune activation that's, chronically activated, it will disrupt what we call the HPA axis or the hypothalamus pituitary adrenal axis. It's a very big part of what regulates our mood, our stress levels. And so chronic activation or dysregulated activity of that as a result of chronic inflammation can really affect a lot of these mood symptoms. Yeah, so I hope that answers that question.
Yes, thank you.
Go ahead, Lindsay. Sorry.
Oh, that's okay. Rachel, did you have a question?
Nope. Keep going.
Okay. The next question we have from someone is, what are the recommendations for reversal of neurological effects? Are there specific dietary recommendations, I would say, other than the obvious gluten-free? Recommendations for reversal.
That's an excellent question. Aside from dietary control and considering whether there could be, concurrent vitamin deficiencies such as folate. Um, the people are exploring other ways to restore, some of the insults in the brain. But I myself have not been involved in any clinical trials in that regard. I was looking at the literature early and uh, last couple of weeks, and it doesn't seem terribly convincing to me. I don't want to be negative about it, but I would say nothing that I read um, looks like it's convincing that someone should sign up for treatment. So I think the main things would be adherence to diet and making sure that essential vitamins are adequate. I
Dr.
should mention
Verma?
in that regard, the brain has an amazing restorative property to it that we don't talk about a lot. There is neuroneogenesis, birth of new neurons, even up into our 40s, maybe even beyond. And and so we see across the age spectrum that the brain can recover from insults. It takes time. Like if there's some damage to the brain, one way you can think about it is that it restores about as fast as our fingernails grow. So, depending upon the extent of the damage, it will repair itself many times, but it can take time.
Interesting. Thank you, Dr. Nordley. Dr. Berman, any thoughts on that question as well, as far as recommendations other than dietary?
No, I would agree with Dr. Nordley. I think sticking to the diet, but also the vitamins become very important. Part of it is if you have celiac disease, then then you're malabsorbing a number of the vitamins. If you're on a gluten-free diet, the foods that are commercially prepared gluten-free foods are not fortified with vitamins. So I think it becomes very important to first of all follow and make sure you're looking at those vitamin levels. And sometimes it's not easy to look for vitamin levels, so you want to see someone who really knows how to look for them. But I would agree, things like folate, B12, B6, iron, I mean, those are deficiencies that we do see generally as well in celiac disease. And then I really want to emphasize the point that Dr. Nordley made, that it takes time. When you have celiac disease and you have abdominal pain, it's one of the first things that improves, and that can improve in 4, 6, 8 weeks. When you're thinking about symptoms like any neurological symptoms, think years. You cannot think days, you cannot think months, but years for this to improve. But over time, it does improve. So it's very important to stick with all the other therapies that are needed. So not to just say, okay, I'm going to wait for a few years for the gluten-free diet to kick in. But if you need physical therapy, you need to see other counselors, you need to see the neurologist. All those therapies need to be continued on along with the vitamins and the gluten-free diet.
Perfect. Thank you for that. And then another question is, are there any connections found between celiac and hand-eye coordination challenges?
Yeah, from a neurologist like our penchant, like if what do? We first try to localize a process and then try to figure out what it is. When you read about and when you see patients with celiac disease, there are a plethora of issues which are not specific for one location in the brain. So they really are more multifocal, or you could say diffuse or multifocal. So I think that's really essential when you're considering. So, what could cause problems with coordination? Well, problems with coordination could come about because your peripheral nerves are not working well and you're not getting proper reading of where your joints are in space. It could also be because of coordination, occurring at the level of the cerebellum, which has been involved. Or it could even be extracerebellar in other regions of the brain that are processing sensory information. So, all of these areas can potentially be involved, and it what we would refer to it in neurology as signs of encephalopathy, of some degree of brain dysfunction.
Thank you for that. Okay, the next question, are non-ataxia, vertigo, and balance issues related to celiac?
Yes, Absolutely, they can be. So the systems that control our sense of where we are also involve the brainstem and the cerebellum. So the central portion of the cerebellum controls ataxia. The nuclei, there are deep nuclei that are close by that region, and they're responsible for coordination of other movements and sensations. So basically, you can think of the cerebellum as sort of like almost like the automatic transmission of the brain. If the brain is like, the engine, and our spinal cord is sort of like the axles, and then peripheral nerves are sort of like, the internal of that, and then the muscles are the tires. The cerebellum, you can think of is the, and its associated nuclei are the thing that smooth out movements and interpretation of data, both in space and time. So yes, those same nuclei are very close.
Okay, all right. Farida, how does celiac disease impact sleep, or does it?
Sorry, my mic was being funny.
That's fine.
So yeah, I think that's a really good question, and I think again, talking a lot about the correlation between or comorbidity between celiac and a lot of mood disorders. I think sleep is one of the factors that we see dysregulated with a lot of mood disorders like depression and anxiety and so forth. But so I think again, addressing this question from a very multifactorial lens, I know that when we think about again, the primary pathway of celiac being an autoimmune condition, very high levels of inflammation upon ingestion of gluten over time. A lot of the pro-inflammatory biomarkers, such as interleukin 6, IL-6, tumor necrosis factor, all these different biomarkers have been shown to alter our REM and non-REM sleep cycles. And a lot of times, this is because they kind of disrupt the hypothalamus, which is a part of our brain that's responsible for regulating sleep. So that's one of the various ways that we can see that. We might see that in terms of frequent awakening, insomnia, difficulty going to sleep, or even just poor quality sleep in general. Another way that we can see that is, as Dr. Nordley had mentioned, with the vitamin deficiencies, sometimes malabsorption of certain vitamins like magnesium and zinc and vitamin D have been shown to also affect REM and non-REM sleep regulation as well. And specifically vitamin D, which has been shown to be linked with a disrupted circadian rhythm. So I think, again, while we recognize that its sleep is affected through those inflammatory processes, through these nutritional deficiencies, and also their comorbidities with some psychiatric disorders, which in of themselves do have an effect on sleep.
Thank you. The next question is, are there any connections between diagnosed or undiagnosed celiac disease and dementia or Alzheimer's disease?
Yes, and but not specifically Alzheimer's, but again, like other signs of encephalopathy or brain dysfunction with long-standing disease, and commensurate atrophy of brain structures, there have been. But I wouldn't conclude that that's but that's of all the things that get affected in celiac, that's relatively rare from a neurologic standpoint. Thank goodness.
Okay, all right, great, thank you. Peripheral neuropathy, we had a lot of questions about that. Is it associated with celiac disease? Is it reversible? Does the gluten-free diet help in this process? All of those questions.
Yes, the answers would be yes, yes, yes. It, the second most common neurologic complaint of people with celiac disease would be peripheral neuropathy. And so it's definitely associated with celiac disease. It definitely does respond to treatment, and as just as we were saying with Dr. Verma, it will get better over time. There have been questions in the chat about that and POTS and other things. So peripheral nerves do a number of things. They convey signals to our muscles to move, but even more sensitive are the temperature components of those nerves. So tingling, what we call paresthesias, painful, things like it's burning or itching, and autonomic symptoms. Those are called small fibers, and they're the most sensitive. So the complaints that the people are putting in the chat are very referable. Small fiber neuropathies will tend to first manifest in the longest distance of the nerve, so typically in the feet or in your hands. So it'll be kind of peripheral distribution. So those would be some clues.
Okay, great. Farida, I know you are very interested in the gut microbiome, so this question I'm gonna send your way. This person is saying that they've had celiac disease for 20 years and on a strict gluten-free diet. They believe that there's a gut-brain connection and the balance of the microbiome can affect us neurologically. And this person believes that their chronic migraines with aura are a result. Do you agree? Can you elaborate on some of your thoughts on that connection?
Yes, absolutely. I think a lot of the literature is now moving towards really understanding the significance of the gut microbiome relationship. I think it plays a significant role in various neurological and psychiatric disorders. But one of the things that we see with individuals who have what we call gut dysbiosis, which is very much kind of the gut microbiota, which is the healthy bacteria that we have in our gut. One of the factors that disrupts it is chronic inflammation. So what we see a lot of times is that with individuals who have chronic exposure to gluten, their gut microbiota will be disrupted. What that means is that they're not only will they have interrupted mucosal lining, so their gut lining will be disrupted, but also, as I mentioned, our gut plays a significant role in the synthesis of a lot of the precursors of neurotransmitters that are affected in movement, in thinking, in processing speed, in mood. So that's one thing. The other thing is one of the healthy strains of bacteria in our gut synthesize something called short-chain fatty acids, or SCFAs. And these have significant anti-inflammatory properties that again help to regulate with a lot of the symptoms that we do see in celiac. And so chronic disruption of the gut lining as a result of that will affect the production of short-chain fatty acids, and in return kind of exacerbate a lot of these symptoms. A big factor that kind of I know Dr. Verma and Dr. Nordley talked a lot about like vitamin supplements, which, I think that's a very, very key component, but also omega-3s, specifically ones that are high in DHA and EPA, have been shown to help a lot with addressing chronic inflammation because they help a lot with the short chain fatty acid production. And also strains like lactobacillus, like bacterial strains, specific ones that we find in yogurt, have also been shown to be very helpful in addressing or healing a lot of the gut lining because they have a lot of these healthy bacteria. So yeah.
Thank you, Farida. Dr. Verma, do you have some thoughts?
I'm going to ask a provocative question to Farida.
Okay.
So you talk about microbiome. So how about probiotics? What do you think about people going out and buying some probiotics? That you think that that's helpful, not helpful? What are your thoughts? And Dr. Nordley would love to hear about your thoughts as well. Probiotics are hot in the celiac community in terms of, is that going to be the cure for celiac disease, or is that going to be something that can be used? So controversial, but let's start a little controversy here.
Thanks, Dr. Verma. I guess I will answer with just my kind of understanding of what I came across in the literature, but I think I've definitely seen the probiotics and prebiotics being a very big hype in the market. And I'm always curious to always read the label of the back of these products because I think that says a lot of in terms of the additives they have and stuff. But I think with a lot of these strains, one of the biggest things that we also look at is the degree of absorption, right? Like it's like we take a lot of these vitamins, how much of these are actually absorbed in our gut. And I think there's a lot of factors that can influence absorption. Again, our gut health overall being the integrity of our gut lining and the pH of our stomach and our small intestine, all of that significantly influences how much of these products that we actually absorb and therefore will translate into how effective these products are. I do think that prebiotics, I am personally someone who prefers getting that through more food-based rather than, through medications or supplements. I'm always an advocate for if you can get it through food, absolutely. Supplements should only be used kind of as needed. However, I do think that, again, when the controversy I see around is how much of it is actually going to be absorbed. And if I'm already having a very good, adequate diet, because at least from my understanding of the research, we are able to get a healthy amount of good bacteria from a good diet that's high in yogurt, high in a lot of antioxidant products. However, obviously for individuals who do not get that, how much that would be helpful is a good question.
Yeah, and I think that, there is this whole some studies looking at the role of probiotics in celiac disease and so on. And I think that I so totally agree with you that rather than doing supplements, the natural way of getting pre and probiotics is probably the best way to do that. And then from a celiac standpoint, of course, there is the concern for gluten cross-contamination. And in fact, there was a study done several years ago looking at various probiotics and that claimed to be gluten-free, and there was some gluten. So I do think that from a celiac standpoint, you need to be a little concerned about the cross contact with gluten. But even if you have celiac or no celiac, the naturally occurring food products with pre and probiotics are probably the best way to go. And I guess meeting with a dietitian who's aware of what are the good food products, looking at your age and looking at everything else that somebody's getting. So from a 2-year-old to a 100-year-old person, we obviously have different needs. So very important to meet with dietitians so that they can help you a little bit with what is pre and what is probiotics and looking at omega-3. I think that that's something we sometimes forget about, but there are good sources of food as well that have the omega-3 without cross-contamination, so one doesn't have to fear those as well. But Dr. Nordley, do you take any probiotics?
No, I don't. And it's certainly outside my area of expertise. There's quite a bit. I completely agree with Dr. Mahmood on all of her points that the gut-brain axis, I'm convinced, is very important. You can stop epilepsy in rat models with fecal transplants. I mean, that's been proven. We don't know yet within the epilepsy world what it is about the gut microbiome that's important to stop the seizures and correct the neurologic issues. But it's a terribly exciting field. Dr. Verma and I were at a lecture. It was a group of talking about AI, and it was AI development at University of Chicago. One of the things that just I thought was amazing was that the microbiome center is using AI because the microbiome is so incredibly complex that they're using artificial intelligence to try to figure out what would be the precise combination of microbiota that would help to restore one's balance. And they gave an example where they succeeded. They actually, according to the presenter, safely eradicated a bacterial infection using microbiome that they microbiota that they had fashioned into a pill, and they have a approved production facility at University of Chicago to do that. So it was so exciting. So I think
Very exciting.
yeah, I think there's a lot that's going to come out of that literature.
And I think as we do probiotics, if somebody is doing probiotics that are more on a commercial basis, I also believe that rotating those probiotics becomes important because you don't want to just populate your gut with the same group that's in that pill versus that powder and so on. But again, going back to the naturally occurring is probably the way to go. I'm going to hand it back to Lindsay. Sorry for hijacking the meeting.
No, that's great. Actually, fascinating information. It sounds like we're heading in a really interesting direction with the gut microbiome. It's exciting. Actually, I'm actually going to turn it over now to Farida to cover the area that Dr. Fink wanted to discuss. Had he been able to come, again, he was ill tonight, so wasn't able to come. But if you would go ahead and share some of that with us, I think that this group will really appreciate that.
Yes, of course. Yes, my pleasure. So Dr. Fink was we're talking a little bit about, given that a lot of the concerns that a lot of people with celiac seem to experience, and we highlighted a lot of that in the previous presentation, but a lot of it, again, being the neurological effects and neurocognitive effects that can occur within the first 24 hours of ingestion. So Dr. Fink kind of talked a little bit about some strategies that even when we do neurocognitive testing, well, I haven't seen anyone with celiac specifically for neurocognitive testing, but again, given the overlap between a lot of these symptoms, we thought that some specific strategies that we would recommend, again, to assist with a lot of these executive functioning processes. So when I say executive functioning, I mean like processing speed, like our attention, just some day-to-day things that you can do. Obviously, the first component being gluten-free diet and vitamin supplements is needed. But again, more of these neurocognitive strategies. So I think a big component when we think about addressing executive functioning is having structured routines. So kind of establishing consistent daily schedules as a way to reduce a lot of the decision fatigue that can come as a result of, again, that brain fog effect where you feel very lethargic, where you don't feel like you want to do anything, and also dependence on memory, which can sometimes, when we're in that kind of confused state, we might have difficulty with executing certain decisions. So having structured routines, prioritizing certain tasks, and breaking tasks into smaller steps can be a great way as a way to ensure like more manageable components and tackle a lot of tasks in a sequential manner. Um, Practicing focus attention is another thing as well. If you think of, if someone had a what we call like a flare up, right? And you're very much in going through the flare up moment, kind of focusing on practicing focused attention. So eliminating distractions, working in a quiet place, being in a clutter-free environment. And when we think a lot about kind of memory aids and tools that we can use, we always highlight the use of, again, in relation to organization. So calendar use, planners, task management. We're living in a world where there's a lot of technology that we can take advantage of. So whether it's electronic calendars that we can utilize, writing things down. I'm very much an advocate of using note-taking through pen and paper rather than computer. I think it's a great way for information to stick. And scientifically, it's actually been proven that information is encoded better when you write it down. Also relying on mnemonics as well. So different ways that you can remember things. So acronyms or visual imagery has been shown to be very helpful, especially if you're more of on the nonverbal kind of learning, like you prefer more visual, you're more of a visual learner. Dr. Fink was also kind of discussing a lot of ways about improving concentration. So again, if we think about that brain fog effect and the fact that it may take a few hours to go away, it may take a few days, depending on your diet, depending on the frequency of exposure to gluten and so forth. One of the common strategies that we highlight is the Pomodoro technique, which a lot of you may have heard of, but the idea of focusing for like a certain period of time, usually 20 to 25 minutes, followed by a 5-minute break, and so forth. So altering that. And so what we do with that is we think of it as like kind of cycling or attention cycling, so that your ability to sustain attention is kind of you're able to do so effectively, and mitigate the effects of brain fog as well. We also talk a lot about physical activity, and I think that's a very, very big component. I think one of the questions we had today was about sleep, and a lot of the recent research is talking about the benefits of exercise actually during the morning rather than evening. And one of the reasons being is because of the cortisol regulation. So individuals who already have sleep difficulties and work out at night, a lot of times cortisol may disrupt a lot of our REM and non-REM sleep cycles. And again, when we think about celiac, kind of that HPA axis disruption that we discussed, if we work out or do just minimal physical activity in the morning, that may help with regulating kind of that hormonal regulation and also our sleep schedule as well. Um, Obviously, we talked a lot about hydration and nutrition, so your vitamins, your supplements, gluten-free diet. And in terms of more memory strategies as well, a very big thing that is very common in the literature is the concept of chunking, where we kind of group a lot of information into smaller sets. So we break a long number of information or a lot of information into smaller sets and we memorize it that way. And actually has been shown and we memorize it that way. And actually has been shown. Oh, oh, I think someone's, thank you. All right. I was like hearing myself twice. I'm like, oh. And so again, I think a big thing that a lot of these things are more short term, but I will say again, I think social and emotional support is very important. Celiac is one of the diseases that can often influence a person's sense of isolation, feeling excluded from certain gatherings, feeling limited in terms of your lifestyle. And so really, really not underestimating the power of social and emotional support as well as a way to kind of help you with either if you're having a flare up or even just lifestyle changes as well. And thinking psychiatric comorbidities. I think someone, thank you. Okay. And so yeah, I think a lot of these are kind of overarching strategies. And I think the final thing that Dr. Fink really wanted to highlight was these are more like day-to-day things that we can utilize on a day-to-day basis. However, if we're looking at more professional interventions, occupational therapy, especially for individuals who may have had long-standing celiac and it's been kind of, a long-standing condition for a while that they've had a little bit of difficulty with dealing with. So consulting with a therapist to develop more individualized compensatory strategies as a way to deal with daily tasks can be extremely helpful. Cognitive behavioral therapy is another important type of therapy that's recommended in the healthcare field, especially University of Chicago. There's a lot of clinics within the Department of Psychiatry that focus on CBT in relation to various health conditions and how do I develop a lot of these coping strategies to deal with a lot of the consequences of these flare-ups. And finally, with neuropsych evaluations, which I think is kind of a bit of my area. Essentially, as we mentioned, a lot of times when we think of as Dr. Verma and Dr. Nordley had discussed, our brain is really, really powerful itself. And while that definitely takes time, and I think patience is a very, very big thing here. But I think ultimately neurocognitive evaluation can be a great way to assess both cognitive deficits and provide more tailored interventions. Especially again, for a lot of people, they may, be adhering to a gluten-free diet for a very long time and still are noticing some cognitive deficits, which usually kind of elucidates to potentially another underlying factor. And so, consultation with a neurologist and a neuropsychological evaluation can be a great way to gain clarity as to, okay, are these factors purely as a result of celiac, or to what extent are the other underlying factors potentially contributing to that as well? That was a lecture, my apologies.
That was great information. Thank you so much for presenting it for Dr. Fink. Very useful things that I will actually put together a little something kind of highlighting some of those in the follow-up email so that people have it. 'Cause I'm sure people are going to want to be able
And
to reference that.
And Lindsay, speaking of follow-up, I just want to give a plug that one thing, Farida, that you said that really struck a chord is obviously people who are adhering to a gluten-free diet and they're still seeing symptoms. I just want to give a plug to the importance of follow-up care with your gastroenterologist and your dietitians as well. And those annual appointments are really important, and annual blood work as well, because it gives a really holistic picture aside from our amazing specialists, where neurological effects could be happening, but also just for coming back to your health, and the management of celiac disease, I think is really important. Sorry, I just had to plug for follow-up care. It's just so incredibly important. And I've seen in the chat so many times where people have noted where 6 years later, they're seeing something present itself. And that's where, you know, you, it takes a whole team of care for a disease like celiac. So that's all. I just wanted to plug that. Lindsay, I'll turn it back over to you.
No, that's great. I just wanted to go to Dr. Verma, Dr. Nordley, see if there's any last thoughts, anything you'd like to add here at the end as we're wrapping things up on this topic.
Lindsay, I was going through the chat. I can take a stab at trying to offer a few key points. I mean, they're really good questions.
Sure. Yes, please.
And maybe Dr. Verma or Dr. Mahmood, you can chip in. There is an association between Down syndrome and celiac, but in answer to the question, I'm not aware of the person who posted of any other comorbidities they should be looking out for. But, maybe as I go on, if Dr. Verma or Dr. Mahmood has anything else. Someone said that there's a relative who has an olfactory aura before the seizure. That is typically localizes to a structure that's in the middle portion of the temporal lobe, the hippocampus or the amygdala. So I would recommend that not be just attributed to celiac, but make sure the MRI is carefully examined. And the best thing is to have what we call coronal cuts, looking through the axis of the temporal lobe. So maybe just touch base with the neurologist, make sure. Typically, we would do what's called an epilepsy sequence for that MRI. Someone asked about functional disease and whether it was a functional disease or a seizure. Let me give you a tip. One of the easiest and most reliable ways is typically in functional attacks, the eyes are closed. 90 some odd percent of the time with an epileptic seizure, eyes are open and deviated. If the episode of the clenching of the fist bilaterally was accompanied by eye closure, it could be functional. And I just want to stress, we take this very seriously, and getting prompt counseling is the most important thing to do in those circumstances. Someone asked about empty sella. I am not aware of that being associated with celiac. I wouldn't attribute that to celiac or IGF-1 unless Dr. Verma has any other information. Someone was asking, it sounds like for a celiac specialist in Oregon. I think other people have been chiming in. POTS is considered a form of dysautonomia, which is a peripheral neuropathy, so an associated. I'm not aware of any association with macular degeneration or meningiomas. So I hope that hits many of the questions that in the chat.
Thank you. And I just want to add with the Down syndrome, I mean, there is an association with celiac disease. So there is a screening that needs to be done for everyone with Down syndrome. The blood tests that are specifically done is a little bit different from a Down syndrome standpoint. So it's very important that if there is someone who has a child or has a relative or someone with Down syndrome, that is something you get to see a gastroenterologist who's aware of what tests to do. It's a little bit different than the others, but there is a screening, just like we need to screen family members on a routine basis in families that have celiac disease. Children with type 1 diabetes or adults with type 1 diabetes need to be screened for celiac. Down syndrome, Turner syndrome, there is definitely an association between these conditions. So the screening test needs to be done for these children. There is a growth hormone deficiency that can be associated with celiac disease. So again, if a child is not growing from a height standpoint, seeing an endocrinologist along with looking at from a nutritional standpoint, because again, if you're short stature, if you're not growing tall, it could be a growth hormone deficiency, which could be independent or could be associated with celiac disease. And celiac disease itself, because of a malabsorption, can give you issues with growth as well. So just wanted to bring that up. And I think that it's so important for us to remember that celiac disease can present in so many different ways and it can have complications. But at the same time, if there are certain symptoms that are not improving or starting while you're on a gluten-free diet, it's important to keep a broad sort of view of it and not just say, well, maybe my diet will help or something like that. So open mind on both ends. If you have symptoms, it can be many symptoms, get the diagnosis of celiac. If you're doing great with a gluten-free diet and you have symptoms, then meeting people that are Dr. Mahmood or Dr. Nordley or other people or psychologists or endocrinologists, any of those is very, very important to keep that in mind as well.
Thank you. Okay, so to wrap things up, I just want to thank all of our panel today and appreciate all the time. And Dr. Fink, unfortunately, for not being able to be here, but we do thank him for his input that was shared with everyone. As I said, I will follow up with an email that gives you the links to this, which we've recorded, as well as the first part that was recorded. And then I'm going to put together a little something with some of Dr. Fink's strategies for dealing with some of the brain fog and things like that. So that will be coming in a few days. It's coming, I promise. It takes a few days for it to all be sent out. So that's it. Rachel, last
No.
thoughts?
Oh, thank you so very much. I want to thank Dr. Nordley and Dr. Mahmood and for tonight. And Dr. Verma, always, it's so nice to have your insight and expertise, all of you. And we appreciate you attending and we will send follow-ups, but just thank you. Have a wonderful night and let us know future topics that you are interested in having outside experts. We would love to hear from you who are living and managing with celiac disease, what other experts you would like to hear from. But thank you, thank you, thank you. And we hope you have a wonderful night and stay warm. I feel like the whole country is cold right now. So thank you all.